Welcome to the office.
Hi.
Hello.
Welcome back, Stephanie.
Thank you.
Nice to see you again.
Nice to see you.
Okay, so it's been the week.
Yes.
How are we doing?
Good.
What did you
Feeling
initially come for?
I came for my lower back and then pain up and down my left side.
Okay, and how is all that doing now? It's been
A lot better. Now I've noticed, like I felt on my way walking in here,
okay.
if I placed my hand on the lower part of my back, I was able to feel like, I don't know if it would be called like a muscle spasm, but the left side of my back felt like higher than the other, and now it feels even.
Good. Okay,
Yeah.
so you feel that the foundation is a little bit more balanced.
Yeah.
Good.
Yeah.
Okay.
Yeah.
How was your walking?
Walking is good. We've been walking all around LA, so that was easy
Okay.
for us. Yeah.
Okay.
Yeah.
And what about your sleep?
My sleep, amazing. Since day one, I've been
Okay.
sleeping through the entire night. I just joked with my sister. I let her know because I was like on Instagram, and this morning I woke up with my phone still on Instagram because I didn't wake up at all throughout the night. It's
Nice.
crazy. It feels amazing. Thank you
You're
so much.
You're welcome. So today we're going to do our last visit for this trip,
Mm-hmm.
and then we're going to figure out what your follow-up's going to be. I would say probably in about a month you'll be able to come back.
Yeah.
Okay, so in about a month you come back. I'll give you some homework to do in the
Okay.
meantime. If there's an emergency and you're not able to get down for any reason, we'll see if we can find somebody local there as well.
Okay.
Okay?
Cool.
All right, sounds good. And do you have any questions for anything I've done on this trip with you?
No questions. Just wondering like what the after will be like.
Today what we're going to do, I'll check spine. We'll finish up spinal evaluation and adjustment.
Okay.
We'll talk about the digestion and the inflammation
Okay.
and the activities.
Okay.
Okay?
Sounds good.
You're itching to get into the gym?
Yes. I'll wait as long as I have to though.
When you get back in, I want you to start with resistance bands only for about 2 weeks.
Okay.
After that, then you'll go back to the weights. You'll do 30 to 50%, at least half the weight you normally did,
Okay.
you'll do.
Okay.
You'll start there, but 2 weeks of resistance bands first.
Okay.
Okay?
Cool. For
Awesome.
sure.
Let's run the meter on the back and let's see what we find today.
Okay.
Starting at the base of the neck. Head down just a bit. There you go. I'm actually just getting flutters. I thought there was a break there. Keeps going. There it is. Just a tiny 5-pointer up top. Mid-back is clear. 2 points. Nope. It's like a 1-pointer. I'll palpate it to see, but it looks pretty darn good to me, y'all. Very
What
cool.
did it start at?
We'll go back to that first video.
Yeah, can't wait.
We
Oh,
were
I'm
pretty.
so excited.
It was pretty high there, yo.
Yeah.
There it is. There's a tiny bit. It's like a 3-pointer. Okay. Scoot forward. Let's check the movement in the hips. Feet together. Open and close the knees. Open and close. Scoot back just a tiny bit. Don't fall off. Open and close. Open and close. Right side only, please. Good. Left side only. Hips are good, yo. Sit back for me. Okay. L5 all the way back. All the way back. S1 all the way back. S2 all the way back. This is where we were, remember? Nothing.
Insane.
Good. No, insanity is doing the same thing over and over again and expecting a different result.
The opposite
This,
of it then.
this is sane.
Yes, the opposite.
Opposite of insanity. You're all clear down down there, dude. This is looking good, yo. I'm happy with it. Nothing is sharp when I'm doing this, correct?
No. Mm-mm.
Yeah, no. Let's check the neck a little closer now. And then we'll work on the extremities. I'm going to do a little bit of guasha to break up some scar tissue for you.
Okay.
I can't let you go just like that. We're going to have to bruise it up a little bit. It might bruise a little. You're okay with it?
Yeah, I'm good with that.
Sit back, please. Mm-hmm. Little tender here.
A little bit.
7, 1. Sharp or just a little tender?
A little tender.
Good. Sharp, tender, or just finger pressure?
Just finger pressure.
Nice. Darn it. This is that one visit, guys.
Why?
There's nothing to adjust in your spine today.
Yay!
This is the first time in a long time.
Really?
I'm gonna work on the other stuff.
Okay.
I mean, unless you want me to crack it, to crack.
No, not if it's not necessary.
There's no pressure there, man. Stephanie, when I was motion palpating, everything was good, nothing was sharp. There was a couple of points, I couldn't justify it though, okay? Let's watch you walk so we have something to compare it to. Guys, there's no adjustment. So what's the moral of the story? And this is the take-home message. This is the thing we want everyone to know. Go to your chiropractor and say, check me and see if I'm clear. Before we walk, let's look at the overall posture. And we have something to compare to, okay? Look at the symmetry. It's different. Look at, remember that swelling in the back? Did you pinch it by any chance?
I did. To
No,
test
like,
it.
did you, after the adjustment?
Yeah, like to notice the difference.
Can you pinch it right now so you can see?
Hardly anything. Like, it was like, I think like out to here.
And it was up here.
Yeah.
Okay.
Yeah.
So the first time we were watching her walk, it was kinking up here. Okay, let's see what we find now. Let's go ahead and walk, please. Very nice. She's even walking smoother.
It feels smoother.
Walk on your toes, please. Turn around, walk on your heels, please. Good. Regular walking. Okay. All right, I'm gonna have you do something just to make sure, okay? You know how to do a push-up? You can do 3 to 5 push-ups?
Yeah.
Crank them out. There you go. 1. Oh, she's doing real push-ups too. Nice. 2, 3, 4, and 5. Stand up, please. I need 3 to 5 jumping jacks.
Okay.
You wanted a workout. 2, 3, 4, 5. 2 more push-ups, please. 1, 2. Hold the plank. Hold the plank. Look up a little bit right there. Good. Come up slowly, please. Walk it off one more time, and then I'm going to rescope you just to make sure, okay?
Okay.
And then we'll continue.
I assume it has to do with it, but I will say that when I would do planks, I felt a lot of pressure on my lower back, and I just now didn't.
There was no pressure now?
Mm-mm.
Good. Good.
Okay.
Come back over here, please. You are all clear. Awesome. Let's work on the ears, shoulders, AIN shoulder, over, around, down. Good. On your back, please. And we'll work on the ankles. We'll check the knees.
Okay.
So process will be this. Let's check the knees, make sure valgus varus stress is good. We did the left knee.
Yeah.
Slide over this way with both your legs. Thank you. Valgus varus stress. Tiny bit. Not like first day.
Mm-hmm.
We will do the tibia. Slide over this way. This one is a little more unstable. I need you to do backwards pedaling for your knees, okay?
Okay.
This isn't an adjustment, this is a strength thing.
Okay.
Okay. So, right ankle, left knee. Okay?
Okay.
Let's do the right ankle first. And first we'll use some lotion. Let's break up that scar tissue. It was a little tough that first time.
Yeah, it was.
We had to use the board. Let's see if we can break up more scar tissue.
Okay.
Questions? Anything we did?
Mm-mm.
Okay.
Good.
Good. It's definitely less. I'm going harder. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Passive range of motion. And let's go ahead and set. Cool.
Awesome. That's great.
Is tight. I'm going up to the first metatarsal, and then I'll come back. A little more. Breathe in. You got some work on that.
Yeah.
What I'd like you to do for that is a lot of barefoot walking, figure eights, doing writing the alphabet with your foot when you're in bed before bedtime,
Okay.
or when you wake up. Turn over onto your stomach, please. Alright, lateral capsule. Now, this is a capsular bulge of the lateral capsule due to a tibial misalignment. If we do not correct the capsule, the adjustments don't really hold. They feel good temporarily. 5, you okay? 4, oh yeah. 3, 2, and 1. Hold on to the table. You good? Nice, gotcha. The bone comb. I talked about why I call it the bone comb.
And I think you said that you had one made out of bone, right?
Correct. Dude, she listens.
I do.
I'm impressed. There we go. Okay. Now, so the purpose of the gua sha or scraping, or, there are many different ways you can do this. The whole purpose of this is to break up any fascial constriction. And you're taking a hard surface on a soft surface. You can't get to it. Like right now, you feel what I'm doing here? Mm-hmm. That's the muscle. That's a little tightness in the muscle. Mm-hmm. But if I do this, there's nothing gritty there, is there? Mm-mm. It's smooth. Mm-hmm. Smooth. You feel that?
Yeah.
Okay, come closer. Okay, that's the grit. But let's say I do it with my fingers. Is that the same thing? Mm-mm. Tell us the difference. So if I'm doing it with my finger versus the comb.
The comb feels more like superficial,
okay.
And then your finger feels like you're going into the muscle.
Exactly. Because the fascia is superficial, correct? Mm-hmm. Now the fun part. You ready?
Yeah.
Okay. You can hear the grit. See? Yeah. All right. 5, 4, 3, 2, and 1. Now let's go up. I'm gonna just go to about here for you, okay?
Okay.
So when I go for my massage, I have my massage therapist. I taught her how to do this.
Mm-hmm.
I have her go all the way up, break up everything in the butt too, okay?
Oh, nice.
And if you have your massage person up there, or you can even have a sister, friend, you guys can do it to each other.
Yeah.
Okay, the whole idea is break it up towards the heart.
Okay.
Okay? 5. I'm gonna be under here, okay?
Okay.
5, 4, 3, 2, 1. One more, okay?
Okay.
5, 4, 3, 2, 1. Very cool. Okay, let's do the left side now. Now, let's notice this. There is more grit here. You feel that?
Yeah.
Okay, that's the calf.
What do you think?
That was the imbalance in your pelvis, causing an imbalance in your gait, causing an imbalance in your muscle movements.
Makes sense.
See?
Yep.
What's different?
This side feels a lot like you're combing through more.
The grit, right?
Yep.
5, 4, 3, 2, 1. And I'm holding this firm just in case so you don't kick me, okay? That's why I'm doing that, guys. What?
I'm trying not
I've
to.
had reflexive kicks.
Uh-huh.
No bueno. No, uy, listen. Come closer. She has a high pain threshold. I'll give her that.
I've been in pain.
You've been in pain a long time, right? No mas. No mas. Now you know. And knowing is half of it, right? 5, 4. Your left side is more red. It's gonna bruise a little more, okay?
Okay.
I'm going under this here.
Okay.
Just to cover it. 5, 4, 3, 2. Hold on. 5, 4, 3, 3, 2, 1. Come on up. Walk it out.
Wow.
Come over here.
I feel so good.
And as I said, remember it's every 5 days per body area. So I did the hams, right? Hams.
Yeah.
So they did the leg. You can do one day of the back of the legs, one day of the front of the
Oh,
legs.
nice. Like
One day
break it up.
switch it up.
Cool. Would
Go on
you...
your back, please.
Okay.
Now, what I'm actually doing here is more the little bit of the thigh or the quadriceps, more of the VMO. I'm just going to be in this area here, okay?
Okay.
This is the VMO, stabilizer. So I want you to even feel this at the patella.
Mm-hmm.
Okay? You can even work it in here. You're going to see such a difference in your leg workouts after this trip. 5, 4, 3, 2, 1.
Is it true that doing this actually helps with making your muscles grow too?
Absolutely. How?
Because you're breaking up that thin threshold.
Correct. So I've talked about it also. Muscle will only grow, expand, and contract according to the fascia. If the fascia is constricted, let's say the muscle can expand to this, but let's say the fascia is constricted and there's scar tissue in there, it's been there for a while, then you're not going to get maximum. So as you're doing this, yes, you get more contraction and stretching of the muscle in that area. You'll see, and you'll let us know next time too.
Yeah. Can't wait.
5, 4, 3, 2, 1. One more.
Okay.
Listen. Come here. Listen. I would like you can even do the ankles yourself. When you stop,
Jeez.
5, 4, 3, 2, 1. I wouldn't be doing anything heavy, squats or deadlifts, until you break this up.
Okay.
Okay? Deal?
Deal.
Okay. Walk it out. So today was more tune the extremities, work on the fascia. There was nothing to adjust. If I would have adjusted, it's just a hero crack. So. Okay.
That's good.
And this is also good information. The number one contraindication to adjusting a segment, we learn in school, fractures, tumors, cancer, things like that. Number one contraindication to adjusting is a normal segment. If it's normal,
Why?
why adjust it? Check the hand. Squeeze, squeeze, squeeze. Nose is good.
Yeah. Looks good too.
Jaw.
Good.
We're good?
Good.
Okay. All good. Squeeze. Squeeze. So what I'd like you to do, we'll follow up in about a month. Okay. Come down for just maybe a back-to-back, a couple of days.
Okay.
If you can just do bands, so in 2 weeks start bands. Let me evaluate you after 2 weeks of doing bands.
Okay.
Everything is looking good, then get into the weights.
Okay.
Fair enough?
Yeah.
Okay.
Sounds good.
Was a pleasure.
It was a pleasure. Thank you so much. Thank you.
You're very welcome.